Hi guys, welcome back to my channel. Firstly, I want to give you guys a short preview of this video. So, trichomoniasis is actually a parasitic disease which infects urogenital tract of male and female, which relates to order Trichomonadida. It is actually a most common pathogenic protozoan. So, let's get into the video. Introduction. Trichomonas is the simplest of all the protozoan parasites because it has only trophozoite stage. Trichomonas infects the urinogenital tract unlike other members of the order Trichomonadida, which inhabit the intestinal tract. Sexually transmitted infection known as trichomoniasis. Significance: 7.4 million cases reported every year, 180 million people infected worldwide, 50% asymptomatic carriers. Habitat: T. vaginalis trophozoite inhabits the vagina in female and prostate and seminal vesicles in males and urethra in both sexes. Characteristics: Trichomonas shows the following important characteristics: an interior tuft of flagella, undulating membrane, and exostyle. Only trophozoite stage, it can survive outside the body at temperature as low as 15 degrees Celsius for up to 48 hours. Trichomonas vaginalis is an anaerobic flagellated protozoan, a form of microorganism. The parasitic microorganism is the causative agent of trichomoniasis and is the most common pathogenic protozoan infection of humans in industrialized countries. Trichomonas vaginalis, facultative anaerobic parasite. It produces energy by fermenting a structure called hydrogenosome, a modified mitochondria in which enzyme of oxidative phosphorylation is replaced by enzyme of anaerobic fermentation. Classification: Phylum Metamonada, class Parabasilia, order Trichomonadida, family Trichomonadidae, genus Trichomonas. Morphology: Trichomonas vaginalis is a flagellated protozoan. Trophozoite is the only stage present in the life cycle. Infective stage of the parasite, no cystic stage. It is 7 to 30 μm long and 5 to 10 μm wide. Trophozoite is pear-shaped and shows twitching type of motility due to the presence of 5 number of flagella. Transmission: Sexual intercourse, mutual masturbation, mother to child during vaginal delivery. Life cycle: The life cycle of T. vaginalis consists of simple division by binary fission under favorable conditions, temperature 35 to 37 degree, pH 5.5 to 6.0, and lack of oxygen. This is how the Trichomonas vaginalis acts on the human urethral cell. Epidemiology: Trichomoniasis is one of the most common infections worldwide. Roughly 25% to 50% of the women in the United States harbor the organism. Asymptomatic infections are common in men and women. The frequency of symptomatic disease is highest among sexually active women in their 30s and lowest the post-menopausal women. During pregnancy and menstrual period, there is a great risk of trichomoniasis because of an increase in pH. Pathogenesis: It is not an invasive parasite. It remains adherent to the squamous epithelium but not columnar epithelium. Virulence factors: protein liquids and proteases help in adherence. Lactic acid and acetic acid, which lowers the vaginal pH. Low pH is cytotoxic to vaginal epithelial cells. Pathology: Intracellular edema and chicken-like epithelium is the most characteristic feature. Signs and symptoms: inflammation of the vaginal canal, vulvar itching leading to edema, tenderness and chafing, redness, yellow and green, foul-smelling discharge, painful urination, dysuria, dyspareunia, menstruate hemorrhages on the cervix known as collaptus macularis or strawberry cervix. Lab diagnosis: specimen, vaginal urethral secretions or discharge, prostatic secretion, semen. Microscopy: in a wet mound of vaginal discharge, the trophozoites have a typical jerky motion. Dried smear stained with hematoxylin is observed under the microscope for confirmation of T. vaginalis. Nucleic acid amplification test NATs are often used because they are highly specific and sensitive. There is no serologic test. Serologic means the entire body test. Culture: a specimen may be inoculated in solid fluid cell-free media. In tissue cultures, in the chick embryo and is simplified trypticase serum may reveal organism when the microscopic examination is negative. Or takeaway point is in a wet mound, the specimen is held between the slide and cover the slip by surface tension. Treatment: Single dose of metronidazole 2 gm once or metronidazole PO 500 gm TDS for 7 days. Treat the male sexual partner. Tinidazole is an alternative drug. Progenosis is a full recovery 100%. Prevention. Personal hygiene, barrier precautions, avoidance of sexual contact with infected partner, detection and treatment of cases either males or female. No vaccine is available. So thank you so much.